All right, that's how welcome you to Glow Health Talk with NMA, Nigerian Medical Association Ondo State Chapter. And today we have a topic of discourse, like you do know every week. We're bringing a guest who knows their onions, who help us dissect the issue of discourse for that day, very well. And today is not an exception. We have another topic and, of course, another guest. And today we're looking at glaucoma, the snake thief of sight, and we have the pleasure of hosting consultant ophthalmologist, FUTA Teaching Hospital, Akure, Dr. Mrs. Stella Adegbehingbe. Glad to have you in the program this morning, ma'am.
Thank you.
All right. You look so nice. You look amazing this morning.
Thank you, and you too.
All right. Thank you very much, ma'am. So, Ekabo, sorry to wait to you, Nigerian Medical Association. Yẹn ti ìpínlẹ̀ Ondo bí n tá a dẹ̀ fẹ́ mẹ́nubà lónìí ní glaucoma, ìyẹn àrùn ojú, wọ́n máa ń pè ní the snake thief of sight. Ó máa ń jí ìmọ́lẹ̀ ojú, òun ló ń pè ní glaucoma. A dẹ̀ ní àǹfààní bá ti ṣe dárúkọ wọn lẹ́ẹ̀kan, àwọn náà ni consultant ophthalmologist FUTA Teaching Hospital Akure. Àtẹ̀rọ kan lẹ́ẹ̀jẹ́ ká tún pé orúkọ wọn lẹ́ẹ̀kan sí Dr. Mrs. Stella Adegbehingbe. Lẹ́ẹ̀kan sí ẹ káàbọ̀ sórí ètò wa.
Ẹ ṣeun olóòtú.
Orúkọ tèmi ni Comfort Ọmọláfẹ́, láì fi àkókò ṣòfò. Kí ni wọ́n ń pè ní glaucoma gan, àti pé báwo ló ṣe yàtọ̀? Ẹ ká kọ́kọ́ bẹ̀rẹ̀, kí ló ń pè ní glaucoma? Torí àwọn kankan wà tó wà associated pẹ̀lú glaucoma. Kí ló ń pè ní glaucoma?
Thank you. Glaucoma is a blinding eye disease. It affects the two eyes. But most times it's asymmetrical. That means the eyes will not be equally affected. What happens is that the eye has water that is produced. And as it's produced in the eye, it has channels in which it flows out. But one way or the other, maybe something happens and it's not flowing out. The pressure builds up. When it builds up, gradually it kills what we call the optic nerve. That is the nerve that connects the eye to the brain, that sends signals from the eyes to the brain. Like if you are seeing an object, that okay, this is this object, it sends it to the brain to interpret. So it builds up and gradually kills it. So nǹkan tá à ń sọ ni pé àìsàn yìí wọ́n ń pè ní Yorùbá ní pé ìyẹn dákẹ́ fọ́jú. Àìsàn yìí ojú ló ń bájà, ìmọ́lẹ̀ ojú ló dẹ̀ máa ń mú lọ. Ojú ó ní omi nínú, omi wà nínú ojú. Tí omi yẹn bó bá ṣe ń wà produced, ó ní bó ṣe máa ń ṣàn lọ, bọ́lọ́run ṣe ti dá ojú nìyẹn. But ìgbà míì kò ní ṣàn lọ bó ṣe yẹ kó ṣàn. Bó ṣe ń wà produced, bó ṣe ń ṣàn lọ, kò ní ṣàn lọ bó ṣe yẹ. So á wá máa pọ̀ nínú ojú, á dàbí ìgbà tí èèyàn bá ń fẹ́ bọ́ọ̀lù. Á máa ojú yẹn tí wọ́n bá fọwọ́ kàn gbà yẹn á le. So iṣan kan wà tí ó so ojú mọ́ ọpọlọ. Iṣan yẹn á wá máa pákú díẹ̀díẹ̀. So tó bá ti ń pákú díẹ̀díẹ̀, torí ìwọ̀n ojú ó ní a máa ń bí ìgbà tá a máa ń ṣe ìfúnpá, tá a máa ń ṣe ìfúnpá blood pressure, a máa ń ṣe ìwọ̀n ojú náà. So ìwọ̀n ojú yẹn á wá lọ sókè, á wá máa pa iṣan yẹn díẹ̀díẹ̀. Bó bá dẹ̀ ṣe ń pa díẹ̀díẹ̀, ìmọ́lẹ̀ ojú á máa mú lọ díẹ̀díẹ̀. Ojú méjèèjì ló máa ń bájà, but ìkan máa ń pọ̀ ju ìkan lọ.
Ẹ ṣeun gan ni dókítà Adegbehingbe. Ẹ jẹ́ n béèrè lọ́wọ́ yín, kí ni ìbáṣepọ̀, báwo ló ṣe yàtọ̀ sí cataract? Torí àwọn èèyàn máa ń dárúkọ cataract, ẹlòmíì á fi glaucoma fi pé cataract. What are the differences, or what are the similarities?
Okay, glaucoma is a cause of irreversible blindness. That means once it happens, if it's not properly treated, within a short period, the person goes blind. Cataract is a cause of reversible blindness. In cataract, there is a lens, a natural lens in the eye. It is transparent. That is what we used to see. But as one gets older, gradually it starts being opacified, it starts being whitish. And it becomes white. As it becomes whitish, the vision reduces. It's that whitish thing that is the cataract. And it is reversible because the mainstay of treatment is surgery. And once that surgery is done, the person receives good vision again. While in glaucoma, it is irreversible. It's dealing with the nerve. It is killing the nerve, the optic nerve that links the eye to the brain, and once the nerve is dead it cannot be regenerated. Ìyẹn ni pé cataract ó yàtọ̀ sí glaucoma. Cataract tó bá bá ojú jà, tí wọ́n bá tọ́jú ẹ̀ ènìyàn á ríran, ó wà reversible. Glaucoma tó bá ń bá ojú jà tí a bá tọ́jú ẹ̀, ojú yẹn máa fọ́ pátápátá. Even tá a bá tọ́jú ẹ̀, ìtọ́jú wa ni pé ká fi reduce, ká fi dínkù bó ṣe máa progress, a fi slow ẹ̀ down. So ìkan ó ṣe é tọ́jú dáadáa kéèyàn ní ríran
dáadáa
padà kó rí ìmọ́lẹ̀ padà. Ìkejì kò ṣe é tọ́jú gbàrà ká rí ìmọ́lẹ̀ padà. A kàn máa fi dín bí èèyàn yẹn, bí ìmọ́lẹ̀ yẹn ṣe máa lọ, a fi dínkù tá a bá tọ́jú ẹ̀ dáadáa.
Ẹ ṣeun gan ni àlejò wa. Tẹ́ bá ṣe ń darapọ̀ mọ́ wa, ètò ìlera lọ́rọ̀ náà lẹ ṣe ń gbọ́ lórí ìkànnì alálùbáríkà Glo 99.1 FM tí a takùn mọ́lẹ̀ sádùúgbò Ìjàpọ̀ ní ìlú Akure ń bí. A dẹ̀ ti ń bá dókítà Adegbehingbe sọ̀rọ̀ láti ẹ̀kan. Let me ask you this. Why is glaucoma referred to as silent blinded disease or sneak thief of sight?
Thank you. It's referred to as silent thief of sight because silent means there are no symptoms. For glaucoma, there are no symptoms. You know, normally when somebody is sick, maybe there will be fever, pain, and all that. For glaucoma, there is no pain, there are no symptoms, especially in the early stages. By the time somebody is having symptoms from glaucoma, that is, the person is advanced. The eye is gradually going blind. Glaucoma, there are no symptoms. So there are two major broad types of glaucoma. We have the open angle, means that one grows slowly, it progresses slowly, while the angle closure progresses very fast. So it is called silent thief of sight because there are no symptoms, especially in the early stages. While it is called thief of sight because it gradually steals the vision, especially starting from the side. We call it peripheral vision. That is why for a glaucoma patient, they will tell you they can see very well because they can see their front, the central vision. If they are looking straight ahead, they can see it very well. But the side, we call it peripheral vision. They can't see it very well. So gradually, it steals the sight. And because there are no symptoms, many people don't realize that they have any problem with their eyes until there is significant loss of vision. So nǹkan tá à ń sọ ni pé dákẹ́ fọ́jú ni, ó dákẹ́ torí kò ní ròyìn, kò ní dùn yín, kò ní ṣe kankan, ojú yẹn kàn máa lọ díẹ̀díẹ̀ ni. Ó dẹ̀ máa ń jí ìmọ́lẹ̀ ara because a máa jí vision béèyàn ṣe ń ríran sí yẹn, a máa dínkù díẹ̀, kò dẹ̀ ní dùn yàn, kò ní ròyìn, kò ní ṣe kankan. So ọ̀pọ̀lọpọ̀ ò dẹ̀ ní mọ̀, wọn ò ní kọbi ara sí. The only thing tí àwọn míì máa ń mọ̀ ni pé ó máa ń kọ́kọ́ mú vision ẹ̀gbẹ̀gbẹ́ lọ. Torí ẹnìkan ti sọ fún mi rí pé doctor, mo ṣàkíyèsí pé tí n bá ń wa mọ́tò mi ò rí side mirror tó wà ní ẹ̀gbẹ́, pé mo ṣàkíyèsí pé mi ò rí. Sign ẹnìyẹn ó ṣàkíyèsí ara, ó tètè mọ̀ because the first thing that he does is vision, side vision a máa lọ díẹ̀díẹ̀. That is why wọ́n á rí wájú dáadáa bọ̀ wọ́n ò ní rẹ́gbẹ́. Ẹlòmíì tó bá yọ la ọwọ́ ẹ̀ sí ẹ̀gbẹ́ tó bá wò kò ní rí dáadáa. Òun ni ẹlòmíì tó bá ń lọ a máa gbá nǹkan because ó rí wájú nìkan kò rí ẹ̀gbẹ́. So wọ́n ń pè ní dákẹ́ fọ́jú, á dákẹ́, kò ní sọ̀rọ̀, kò ní fúnyàn ní sign, kò ní ròyìn, kò ní ṣe kankan, á dẹ̀ máa jí ìmọ́lẹ̀ ojú yẹn lọ díẹ̀.
Tó bá ti ń di ìgbà tí ẹni yẹn ò ríran lẹ́gbẹ̀ẹ́ yẹn bẹ́ẹ̀ ṣe sọ yẹn, ṣé ó ti bọ́ sí, ó ti di pé kò wá irreversible àbí wọ́n sì lè máa tọ́jú ẹ̀ bọ̀ kò ní rí ìwòsàn àbí tó bá tọ́jú á sì rí ìwòsàn?
Glaucoma, dákẹ́ fọ́jú, ara earliest symptoms sign torí kò ń ròyàn, kò ń dùn yàn ni pé èèyàn ń rí ẹ̀gbẹ́ ló ti ń bẹ̀rẹ̀. Ó máa ń fọ́jú bọ̀ ojú tó ń fọ́ yẹn ẹ̀gbẹ́ ló ti ń bẹ̀rẹ̀. So ọ̀pọ̀lọpọ̀ wa àdẹ̀ ń ṣàkíyèsí. So téèyàn bá rí i pé ẹ̀gbẹ́ yẹn, ẹlòmíì máa ṣàkíyèsí. But tí nǹkan tá à ń sọ ni pé tí a bá tètè mú àìsàn yìí ní ìbẹ̀rẹ̀ tí òun ṣe ìgbà tó ti bọ́ sórí, tó ti wà advance, ó ṣe é manage. Ìyẹn ni pé a bẹ̀rẹ̀ treatment, a bẹ̀rẹ̀ sí ń tọ́jú ẹ̀. Tá a bá dẹ̀ ti ń tọ́jú ẹ̀, bí ẹni yẹn ṣe máa bí ìmọ́lẹ̀ ojú yẹn ṣe máa lọ á dínkù díẹ̀ kò ní tètè bí ó bẹ́tà ju ìgbà tí a lò kọ̀ọ̀kan tá a tọ́jú ẹ̀ kíákíá ojú yẹn á lọ but tá a bá ń tọ́jú ẹ̀ bójú yẹn ṣe máa progress bó ṣe máa lọ bó ṣe máa burú sí á dínkù.
ẹ ṣeun gan ni àlejò wa ọ̀sẹ̀ yìí ni wọ́n celebrate Global World Glaucoma Week. Kí ni theme fún ti ọ̀sẹ̀ yìí tọdún yìí àti pé kí ni significance ẹ̀ gan fún àwọn mẹ̀kúnnù.
World Glaucoma Week is an annual event globally. And for this week, for this year, it was the date for this year is 8th to 14th of March, and it's usually a week long. And the theme for this year is uniting for a glaucoma-free world. That means gbogbo wa fẹ́ pawọ́pọ̀ pé kí a gbọ́ nípa ọ̀rọ̀ àìsàn glaucoma yẹn, ká mọ nǹkan tó jẹ́, ká dẹ̀ lọ ṣe àyẹ̀wò, ká ṣe screening so that tá a bá rí a tètè bẹ̀rẹ̀ sí tọ́jú ẹ̀. Torí nǹkan tí ọ̀sẹ̀ yìí wà fún ni pé a fẹ́ káwọn èèyàn mọ awareness, mainly for awareness about this silent thief of sight which causes gradual progressive peripheral vision loss. Awareness pé ká gbogbo èèyàn mọ̀, kí gbogbo ayé mọ̀, kí gbogbo èèyàn mọ̀ pé àìsàn kan wà o tó ń jẹ́ dákẹ́fọ́jú o, tó ń jẹ́ sneak of sight o, tó ń jẹ́ glaucoma o, tó ń mójú lọ o, tó ń affect ojú méjèèjì o, tó jẹ́ pé a ní láti ṣàkíyèsí ká máa yẹ ojú wa wò pé tá a bá dẹ̀ rí from screening or 10 times tá a bá pick ẹ o, tá a bá tètè pick ẹ lì o pé a bẹ̀rẹ̀ treatment, tá a bá dẹ̀ ti bẹ̀rẹ̀ treatment bí ó ṣe máa dàgbà sí àdínkù, bó ṣe máa progress àdínkù so that ojú yẹn kò ní lọ pátápátá, so that our gradual. And it's also to enlighten everybody worldwide and to encourage everybody so that there will be global collaboration, communities, clinicians, individuals, that there's this blinding eye disease, this irreversibly blinding eye disease called glaucoma, so that we can screen and pick early and have early detection, because once we pick them early we can start treatment early.
Thank you very much, our guest, Dr. Mrs. Adegbehingbe. Very, very quickly. Of course, as most glaucoma patients are asymptomatic, like you said, until significant vision loss occurs. I'd like to ask you, at what age bracket can glaucoma develop? What age bracket?
Thank you very much. Glaucoma affects all age groups.
Even from birth?
There are some children that are born with glaucoma. We call it congenital glaucoma. Some children, as they are developing, as they are growing, they develop glaucoma. We call it developmental glaucoma or juvenile glaucoma. But the commonest of them is age-related. From 40 years of age, the risk increases. People just like for most diseases, as you get older, the risk of having all these diseases, it increases. And from 60 years of age, the risk is even higher. So that is why it is important that we check our eyes. Glaucoma affects all age group. There's no age bracket, though it is commoner in the adults. But we see babies born with it. We see children that develop it after some years. And we see even young adults that develop it after some time, that we did not have it from when they were born, but just developed it, while majority are in the adults.
Okay.
Ìyẹn ni pé àwọn àìsàn ojú yìí gbogbo ọjọ́ orí ló ń bájà. A rí àwọn ọmọ tá a bí pẹ̀lú ẹ̀, a máa ń bí àwọn ọmọ pẹ̀lú ẹ̀. A rí àwọn kan tó jẹ́ pé bọ́n bá ṣe ń dàgbà ọmọ kéékèèké, wọ́n á rí pé wọ́n ti ní àìsàn yẹn, bọ̀ wọn ò bí wọn mọ́. A rí àwọn míì young adults tó jẹ́ pé a rí wọn bá ṣe rí wọn pé àwọn náà ti ní, bọ̀ wọn ò bí wọn mọ́. Ó develop along the way. But ọ̀pọ̀lọpọ̀ ẹ̀ èyí tó wọ́pọ̀ jù àgbàlagbà ló máa ń bájà.
Ẹ ṣeun gan.
Bá ṣe ń dàgbà sí.
Kó tó di pé mo béèrè àwọn nǹkan tó ń fa glaucoma yìí, mo fẹ́ béèrè lọ́wọ́ yín, ẹni ẹ̀wọ̀n mi wọ́n á bí pẹ̀lú ẹ̀. Kí ni a lè separate tí aláboyún bá ní glaucoma? What is your organization doing, to prevent from mother to child transmission of glaucoma, especially when you have a baby And is it possible for a pregnant woman to transfer glaucoma to an unborn child? Or probably by the time they give birth to that child automatically has it, because everything, the traits of the mother is what, the child feeds on and gets during pregnancy. Once the child is born, is it possible for a child born of a glaucoma mother having a glaucoma too? Is it possible at birth?
Yes, it's possible.
And how do we, if it's possible, how do we prevent it?
The cause of glaucoma, which is going to be your next question, the cause is unknown. But the most important thing that we know is that it runs in families.
Oh,
it's
heredited.
genetic. It runs in families. So that is the main. So nǹkan tá à ń sọ ni pé ó máa ń wà nídìílé. Nǹkan gangan tó ń fa glaucoma àmọ́ pé bóyá ẹ jẹ nǹkan báyìí ni o àbí ẹ ṣe nǹkan báyìí rárá àmọ́, but a mọ̀ pé ó máa ń wà nídìílé. So it's genetics. So a mọ̀ pé téèyàn kan bá ti ní glaucoma báyìí, nǹkan tá a máa sọ fún ní ilé ìwòsàn, gbogbo ẹbí yín ẹnìkan wá check ojú yín o, kí bàbá yín wá check, kí ìyá yín wá check, káwọn ẹ̀gbọ́n yín àtàbúrò yín kan wá check ojú wọn, because we know it's been documented and is the fact. Statistics have shown it and we see it every day that it runs in the family.
Science has proven it.
Yeah, it runs in the family. That's the main thing that we know. But the main cause is unknown.
How come you don't know the main cause? I mean, research should have been on for a very long time.
What I mean by the main cause, like when you have malaria, we know that you were bitten by Anopheles mosquito.
Of course.
Glaucoma is not like that. But we know that it runs in family. It's genetics. It runs in the family.
Okay, I don't want to ask you further. Let me ask you the next question here. But then before I ask you this next question, what are the risk factors for developing glaucoma?
There are many. Like I said, the cause is unknown, but there are a lot of risk factors.
Okay.
The number one risk factor and the most important is intraocular pressure. Just like we check blood pressure, the eye also has pressure. So we measure the pressures in the eye. So once someone has high pressures in the eye, the risk factor is very high of developing glaucoma. Then another...
Now, I want you to break high pressure. How do you mean? Using the eye too much?
Yes. When you check a BP, blood pressure, you know the normal values.
Okay.
That if it's above this value, the person most likely has hypertension, has high BP. Same goes with the eye. We have a normal value when we check the pressure in the eye. We use our equipment in the clinic to check the pressure. When you check the eye, there's a range of value between this and this. That is the normal value. So anything above that value is high pressure for the eyes. So most likely that person has glaucoma. But for such a person, we will label the person glaucoma suspect until we have carried out all the other tests to confirm the diagnosis. So that is what I mean by the pressure.
Okay.
So it does the intraocular pressure. So for some people, they have high pressures and they don't have glaucoma from the other test. So we keep monitoring them because the risk of them developing glaucoma later is very high. So that is number one risk factor for glaucoma. Then family history, very important. Once there is glaucoma in the family, every member of that family should have their eyes checked. And what they will tell us is that so and so has glaucoma, or there's glaucoma history in my family. So we know what to do. So that we'll do all the other tests so that we can pick early. Then the black race, the Africans. Studies have shown that black color is a risk factor for glaucoma. And not even only a risk factor, the disease tends to be more aggressive in blacks. And the rate of blindness is 15 times higher in blacks. So our skin color is a risk factor. Then the other risk factor, those of us that wear glasses, that have refractive error, especially those of us that can't see far, myopic patients, is a risk factor. That's without your glasses, you can't see far. Like me, I need glasses to see what is far. I'm myopic. It's a risk factor. Then we have other things like hypertension is a risk factor. Anybody that has hypertension, glaucoma has a high risk of developing glaucoma, or diabetes, is a risk factor. So nǹkan tá à ń sọ ni pé
torí mo fẹ́ ní kẹ́ ẹ ṣàlàyé ẹ̀ lédè àbínibí wa.
àwọn nǹkan tá à ń sọ ni pé kí ló ń fa àìsàn yìí gan dákẹ́fọ́jú glaucoma, pé kí ló ń fà. So àwa ní nǹkan kan tá a mọ̀ ni pé ó máa ń wà ní ìdílé. so a máa ń sọ pé anybody ẹnikẹ́ni tó bá ní àìsàn yẹn pé kó sọ ní ìdílé wọn pé tó dà gbogbo wọn wá lọ yẹ ojú wọn wò. A dẹ̀ tún sọ pé a máa ń pe kinní kan ní ìwọ̀n ojú, pressure ojú, pé tó bá lọ sókè, àwọn kan wà ó máa ń lọ sókè, ó ní nọ́mbà tá a máa ń wò, range tá a máa ń wò tá a fi máa mọ̀ bóyá ó lọ sókè ni o àbó lọ sílẹ̀ ni àbó normal, pé àwọn kan wà tí wọ́n máa ń ga, pé tó bá ti ga bẹ́ẹ̀ yẹn àwọn yẹn wọ́n ní risk àti develop glaucoma. A dẹ̀ tún sọ pé àwa èèyàn dúdú pé risk pé a lè ní glaucoma ó higher than àwọn tí ò ń ṣèyàn dúdú, and that àìsàn yẹn tún máa ń burú, ó máa ń lágbára gan ní èèyàn dúdú ju àwọn tí ò ń ṣèyàn dúdú lọ. A dẹ̀ tún ní àwọn tó ní diabetes, tó ní hypertension, àbí àwọn tó ń lo glasses bẹ́ẹ̀ bẹ́ẹ̀ lọ, pé wọ́n lè ní glaucoma, wọ́n lè develop glaucoma. So gbogbo àwọn tó bá ní irú anything bẹ́ẹ̀ yẹn ẹ jọ̀ọ́ kàn wá sí hospital so that a lè yẹ̀ wọ́n wò.
Ẹ ṣeun ní àlejò wa, tẹ́ bá ṣe ń darapọ̀ mọ́ wa ìtìlera lọ́rọ̀ pẹ̀lú Glo, pẹ̀lú ìbáṣepọ̀ Nigerian Medical Association náà lè ń gbọ́. Àlejò wa nurse ní Dr. Ms. Adegbehingbe, àwọn náà ti ń bá wa sọ̀rọ̀ jomitoro ọ̀rọ̀ látẹ̀kan lórí àìsàn ojú yìí tí wọ́n ń pè ní glaucoma, àti àwọn èèyàn mọ̀ pé adákẹ́ fúnni lójú, òun náà ni a ti ń sọ mẹ́nubà ní àti ẹ̀kan. Ẹ máa rántí wípé ẹ lè gbọ́ wa lórí Radio Garden Glo 99.1 FM. Ẹ tún lè download app wa Glo FM app lórí Google Play Store, tàbí kẹ́ lọ sórí Facebook wa báyìí, ẹ máa wò wá kedere báyìí lórí Facebook ní Glo 99.1 FM Akure, ìyẹn ní orí Facebook náà la wà. Ẹ lè fi àwọn ìbéèrè yín ránṣẹ́ sí abẹ́ live streaming session wa, ìyẹn ní ẹ̀rọ ayárabíàṣá Facebook. Ẹ jẹ́ àdẹ́tọ́mìnà à ń bọ̀, ẹ má yí kúrò ń bẹ̀. All right, you're welcome back. It's still Glow Health Talk with NMA Nigerian Medical Association Ondo State Chapter, and of course, we're looking at glaucoma, the sneak thief of sight. And we've been playing a host to Dr. Mrs. Stella Adegbehingbe. She's a consultant ophthalmologist, FUTA Teaching Hospital, Akure. And of course, you've been doing justice to the questions being asked. Remember, we are live on Facebook at Glow 99.1 FM, where you can drop your comment under the live streaming session in case you have questions for us. We'll be opening the phone lines in 15 minutes. But before then, we'd like to ask our guest, How can we know that glaucoma is developing our eyes, the early symptoms and signs before it progresses to blindness? You mentioned just one the other time, we're not being able to see your side, left and right. What other things, or is just that? Are those the only signs? What are the signs, that we can early detect that it seems this person might be developing glaucoma or has glaucoma?
Thank you. Like I said before, glaucoma in its early stages has no symptoms and has no sign until the vision loss is advanced. So when the vision loss is advanced, by the time you start seeing signs, the person might see halos around light. What do I mean by that? When they look at the bulb, they will tell you, doctor, I'm seeing something like different colors, like rainbow around the light. That's like the bulb when I'm looking at it. I'm seeing different colors around it like rainbow. Most times when that happens, at that point in time, the pressure in the eye, which I have been talking about, is usually high. Now, some people will tell you, I changed my pair of glasses last 6 months and I'm not seeing with it again. When you are changing your pair of glasses too often, please have your eyes checked for screening for glaucoma. Some people, they'll be bumping into objects. I said earlier that the vision loss in glaucoma starts from the periphery, starts from the side and narrows down. That is why in our clinic, when you come in, we tell you to read a chart. A glaucoma patient, even with advanced glaucoma, sometimes we read everything from up till down, but we'll not be able to. As he's walking, he can't walk well. He's hitting objects because we call that tunnel vision. The central vision is maintained till the last time, till the last vision is lost. It starts from central sideways and closes in gradually. So some people will be bumping into objects. But basically, those are for advanced cases. And there's a type of glaucoma in which it's not common with us, it's common with Caucasians, in which it is very severe. It has severe pain. That's acute angle closure glaucoma. The patient will come in with red eyes, very painful. There might be nausea, vomiting, all the works. And that is for angle closure glaucoma. But the commonest for us here is the primary open angle glaucoma, in which there is no sign in the early stages. But these signs I'm talking about is when it is not early. So that is why we are doing awareness and we are calling for screening so that we can pick it up in the early stages before it gets to that. So what we are saying is that nǹkan tá à ń sọ ni pé glaucoma yìí gangan ní ó bá ti ń bẹ̀rẹ̀ kò sí àpẹẹrẹ kankan, òun la fi ń pè ní dákẹ́fọ́jú. Bó bá ṣe ń burú sí ẹlòmíì tó bá ṣe ń rìn a máa gbá nǹkan, a máa gbá tébù, gbá chíà, bó bá ṣe ń lọ kò ní a máa gbá nǹkan. Ìyẹn ni pé bó ṣe ń ríran láti ẹ̀gbẹ́ ó ti ń lọ. Ẹlòmíì tó bá ṣe ń bí àìsàn yẹn bó bá ṣe ń burú sí tó bá wo ná a sọ pé dókítà wọn á sọ pé wọ́n rí òṣùbàrè. Màá ní kí ló ń jẹ́ òṣùbàrè? Wọ́n á ní oríṣiríṣi kọ́lọ̀. tó bá wo bọ́ọ̀bù nínú ilé wọ́n á rí oríṣiríṣi kọ́lọ̀ tó wà ní ara bọ́ọ̀bù yẹn tó yíká bí ìgbà tí a bá rí rainbow. Ní píríọ̀dì yẹn, ìyẹn ni pé ìwọ̀n ojú yẹn, ìyẹn pressure ojú tá à ń sọ yẹn ó lọ sókè, òun ló fún ní gbogbo nǹkan bẹ́ẹ̀ yẹn. Ẹlòmíì á gba glasses oṣù mẹ́fà kò tún ní ríran mọ́, á tún gba glasses. Ẹlòmíì á lóhun tí òun tó ń change ẹ̀ wẹ́lẹ́wẹ́lẹ́ ni pé tóun bá ti gbà òun á fi ríran, tó bá ti lò ó fún oṣù mélòó kan kò ní fi ríran. Ó bẹ́tà ká screen ẹni yẹn fún àìsàn dákẹ́fọ́jú, bóyá nǹkan tí ó wà ń bẹ̀ nìyẹn.
Ẹ ṣeun gan ni àlejò wa. Mo fẹ́ béèrè ìbéèrè lọ́wọ́ yín, bóyá kí n lo èdè Gẹ̀ẹ́sì. How is glaucoma diagnosed and what treatments are available for glaucoma?
Glaucoma diagnosis, there are different tests. When we see a patient and we are suspecting glaucoma, there are different tests that we order. Apart from, I told you we will check the pressure in the eye. The pressure in the eye might be high. For some people, they will have normal pressures. What I mean is that it will be within the normal range and they will still have glaucoma. So when we see a patient like that, there are further tests that we need to do, which we carry out in the hospital. It's central visual field, OCT, gonioscopy. There are many. So when we now do all these tests and we look at them, we put them together. That is what will guide our decision. That, okay, this person has glaucoma. Then we will not characterize it. What type of glaucoma? Because there are different treatments for different types of glaucoma. From the results of the test, we know, the broad group, the person has glaucoma. Now, what type of glaucoma? Because there are different treatment for angle closure glaucoma and different treatment for open angle glaucoma. Different treatment for acute angle closure glaucoma. What I mean is that different types of glaucoma, there are different types, and there are different treatments for them. Now, when we now pick them, the different treatments for glaucoma is medically, that means we use eye drops. We also use tablets. Then we can use laser surgery. And we can use laser. Then we can do surgery. So nǹkan tá à ń sọ ni pé báwo la ṣe ń mọ̀ pé èèyàn ní àìsàn dákẹ́fọ́jú yìí gangan. Pé tá a bá ti rí ẹni yẹn, tá a bá ti wò ó, tá a ṣe àyẹ̀wò wa, tá a wò pé ó dàbí ẹni pé ẹni máa ní àìsàn dákẹ́fọ́jú o. Ó ní àwọn àyẹ̀wò kan oríṣiríṣi tá a tún máa ṣe. Torí àìsàn yìí ó pín sí ọ̀nà oríṣiríṣi ẹ̀ ló wà. So tá a bá ti ń ṣe bẹ́ẹ̀ yẹn, tá a bá ti ṣe àyẹ̀wò wọ̀nyẹn, oríṣiríṣi àyẹ̀wò, tá a bá ti wò ó, àkó gbogbo ẹ̀pọ̀, àwa wò ó pé okay, irú àìsàn dákẹ́fọ́jú wo leléyìí ni, ṣé léyìí ni àbí ìkejì ni àbí ìkẹta ni àbí oríṣiríṣi ẹ̀ ló wà. Torí àwọn oògùn tá a máa ń lò fún wọn ó yàtọ̀ síra. So tá a bá ti mọ irú èyí tí ẹnìyẹn ní gangan, àwa mọ irú oògùn tá a máa lò fún. So a dẹ̀ sọ pé a lè lo eye drop, oògùn tá à ń kán sójú. A lè lo oògùn tá à ń mu, tablet. A lè lo ti òyìnbó laser. A dẹ̀ lè ṣe iṣẹ́ abẹ. Ó depend lé nǹkan tí ẹnìyẹn bá dé. Tolúkálukú ọ̀tọ̀ọ̀tọ̀ dẹ̀ ni. Òun ni a fi máa ń sọ pé àwọn èèyàn wá ní ojú ń dun eléyìí, ó dùn irú ẹ fẹ́ jọ irú ẹ̀, ó yẹ fún mi oògùn tẹ lò, wọ́n á kan sójú. Rárá, ó yàtọ̀ síra. Ẹlòmíà wá, mo sì rẹ́ nìkan lánàá, ó ní pé òun gbójú ń lọ bá ẹnìkan torí wọ́n ní ẹnìyẹn ṣe ní àwọn tìbílẹ̀, pé ẹnìyẹn ṣe, pé ìgbà tó dẹ̀ ṣe ẹnìyẹn rí, ẹni tó ń ṣe fún ríran lòun fi gbójú ń lọ síbẹ̀, pé ìgbà tóun wá ṣe tòun, òun ò ríran. Nǹkan tó olúkálukú ní ọ̀tọ̀ọ̀tọ̀, treatment olúkálukú ọ̀tọ̀ọ̀tọ̀, so kò jọra. Wọ́n á ní ẹni lo irú oògùn ojú yìí, òun náà ń lò, ó yàtọ̀ síra. Torí nǹkan tó ní ó lè yàtọ̀ sí nǹkan tí ẹnìyẹn ní, so tó olúkálukú ọ̀tọ̀ọ̀tọ̀.
Ẹ ṣeun gan ni àlejò wa, tí ń rí àwọn èèyàn tó ń like gbogbo ohun tẹ̀ ń tan lórí ẹ̀rọ ayárabíàṣá yẹn Facebook. Ẹ lè wá kedere ń bẹ̀ ní Glo 99.1 FM Akure. Àti ní ìbéèrè láti ìbéèrè lọ́wọ́ yín, àwọn treatment wọ̀nyí, ìwòsàn wọ̀nyí, ṣé wọ́n wà available, locally fún wa? Ìyẹn treatment fún glaucoma, are they available?
Yes, they are available. The medications are available, the surgeries are available, can do the surgery. So, but there are different types of medications. And like different medications have their side effects. So, if this patient uses this and comes back and complains, this is what is happening, we'll review it and change the drug based on the condition of the patient. Because while some people, you give them medication, they're not having any issues with it. They don't have any side effects. But there are some people that will have some side effects, Like one of the eye drops, it causes daytime somnolence. That means the person will be feeling sleepy.
Dizzy.
Yeah, sleepy. So the person came and said, doctor, I noticed that since I started using this medication, I knew that was it, because it makes them sleepy. So different drugs have their different side effects. That is normal with all medications. It's just like our body. Some people don't react to anything. If you give them no side effect. While some people, kekere, want any side effects. So individual differences. But basically, a lot of our patients do well on their medications. They don't have any side effects. They don't complain about side effects. But a lot of people think that once they are diagnosed with glaucoma, pé tó bá ti sọ pé wọ́n ní àìsàn dákẹ́fọ́jú, pé tá bá ti fún wọn ní oògùn yẹn, tó bá ti lò tán, ó tán nìyẹn. So àwa máa ń sọ fún wọn pé kò ṣe bẹ́ẹ̀. Àìsàn glaucoma is like having hypertension or diabetes.
That brings me very quickly to can glaucoma be cured or only managed?
Glaucoma cannot be cured.
Okay.
It can be managed. Just like hypertension cannot be cured and diabetes cannot be cured. You're on medication for life. Once somebody is diagnosed as having glaucoma, the person is on medication for life. That's what I was about going into, that they will use their drugs for 1 month or when that set finishes and they stop. No, the medication is for life. It's just like when you are using your BP medication and the pressure is controlled, the blood pressure is controlled, it comes down and you stop, it goes up again. It's the same thing with the eye medication, because we are talking about pressure. Ìwọ̀n ojú yẹn pé ó ga, àwọn oògùn wọn yẹn pé kí ìwọ̀n ojú yẹn kó lè lọlẹ̀. So tí ó bá dẹ̀ ti lọlẹ̀, tí ìwọ̀n ojú yẹn tí wọ́n bá ti ń lo oògùn yẹn tó bá ti lọlẹ̀, iṣan ojú yẹn á ní àlàáfíà, kò ní mọ pressure, kò ní máa wà squeezed, á lálàáfíà. So tí wọ́n bá ti ń lo oògùn yẹn, ìwọ̀n ojú yẹn á lọlẹ̀. Tí wọ́n bá ti stop ẹ̀, á padà sókè. So what I'm saying is that the medications are for life. Glaucoma cannot be cured, but it can be managed. So the medication is for life, and they have to keep buying it. And unfortunately, for most people, for us, the medications is like they counted it in it. It's 1 month. Ó máa pé 1 month á tán, á pé oṣù kan á tán. So monthly they have to buy it. The drugs are available.
Are they expensive?
Drugs are generally expensive.
No. We have to be very small. Of course, we know that. Glaucoma drugs, are they expensive?
They are
and are they lifelong?
They are different. They are lifelong, but they are different types. They all have their ranges. There are different types. Some are cheap, some are expensive, some are not so expensive, depending on what you call expensive. But as you know, drugs are expensive and they are increasing every day. But what give the patient is what works best for the patient. And that is why there is also a support system that is called World Glaucoma Association among the patients. So they try to help themselves. There are counselors who talk to them, Not seeing can be depressing, so there are people that can work with them, and also pharmaceutical companies that try to help them with their medications so that it will not be too expensive for them. So there's a support system like that. Nǹkan tá à ń sọ ni pé àwọn tó bá ti ní glaucoma yẹn, ó ní association kan àwọn patients tó ní tí àwọn èèyàn kan wà tí àwọn counselor tí wọ́n máa ń bá wọn sọ̀rọ̀, tí wọ́n máa ń help wọn, àti àwọn tí wọ́n báwo nípa oògùn wọn náà kó má ba wọn jù fún wọn.
Ẹ ṣeun gan ni, mo fẹ́ béèrè ìbéèrè yìí lọ́wọ́ yín, a dẹ̀ lérò pé máa fún wa ní ìdáhùn tó péye lórí ẹ̀. Dó ẹ ti sọ fún wa pé àwọn oògùn yẹn pé wọ́n generally. How important, is community awareness and media programs like this in preventing blindness?
It is very, very important, because that is why it's a week-long program, and we've been doing that screening. We've been screening in our hospitals, and we've been talking, because it's very important, because this disease must be picked early. That is just the prevention. It must be picked early. That is how we can prevent blindness, if it is picked early. So from awareness, radio programs, talking, screening. So when we do this on media and you help us as you are helping us now, it goes a long way. People are aware, people hear, people listen, and they come to the hospital. A lot of them tell us, agbonyin lórí radio la fi wá. And we try to answer, the patient load is much, but we try to, if it's for screening, we try to quickly screen them so as not to discourage people, so that we can get more and more people. So it's very important. Awareness. It cannot be too much. It cannot be overemphasized. And láti máa sọ káwọn èèyàn lè gbọ́ pé àìsàn kan wà tó ń jẹ́ dákẹ́fọ́jú, Ọlọ́run ní gbójú lọ́wọ́ wa, pé ká jọ ká wá hospital ká wá check ojú wa. Òun la fi máa ń sọ pé ojú dùn ẹ́ o, ojú ò dùn ẹ́ o. Check ojú ẹ ẹ̀kan lọ́dún. Ojú dùn ẹ́ o, ojú ò dùn ẹ́ o. Check ojú ẹ ẹ̀kan lọ́dún. O ní ìdílé yín ní àìsàn ojú o, wọn ò ní àìsàn ojú o. Check ojú ẹ at least ẹ̀kan lọ́dún. Pé bá ṣe ń ṣe ti gbogbo ara, tá à ń ṣe àyẹ̀wò ara, ká máa ṣe àyẹ̀wò ojú wa náà. Like as we are doing general comprehensive examination for our body, we should also check our eyes.
Ẹ ṣeun gan ni, ó dàbí pé ẹ ti mẹ́nu bà àwọn nǹkan tí àwọn health organizations ṣe láti dínkù àrùn glaucoma ilé àwùjọ wa. Mo fẹ́ béèrè lọ́wọ́ yín, kẹ́ ẹ wá sórí rédíò nìkan, sensitization tẹ́ ẹ ní ẹ̀ ń ṣe nílé ìwòsàn, ǹjẹ́ ẹ rò pé awareness yìí tó lórí glaucoma? Ṣé ẹ rò pé ó yẹ kẹ́ ní bíi jingles tá a máa lọ continually, not seasonally, lórí radio torí gbogbo èèyàn kò ń ṣe gbogbo èèyàn ló máa láǹfààní láti wo television lórí rédíò táwọn èèyàn fi mọ̀ pé ńgbà tó bá ń gbọ́ advert lórí àrùn ojú bí ẹ̀ẹ̀mejì àbí ẹ̀ẹ̀mẹ́ta lójúmọ́ tàbí ẹ̀ẹ̀kọ̀ọ̀kan lójoojúmọ́ tẹ́ni tí ò bá gbọ́ lọ́jọ́ Monday á gbọ́ lọ́jọ́ Tuesday kí lẹ rò sí nǹkan bí eléyìí ṣé ẹ rò pé awareness tẹ̀ ń ṣe kó tó di ọjọ́ tòní torí èní ni glaucoma week parí kí lè ṣe ẹ rò pé ó tó awareness tẹ̀ ń ṣe lórí glaucoma.
olóòtú òótọ́ yẹ kó máa pọ̀ sí tẹ́lẹ̀ ìgbà tá a pọ̀ ní àwa tá health worker tá a wà on ground.
so ẹ pọ̀ mọ́ báyìí.
bẹ́ẹ̀ ni mà ìgbà tá a pọ̀ a máa ń ṣe program lórí rédíò àti tẹlifíṣàn every week 7 a.m. Wednesday morning but bí a ṣe ń dínkù agbára ò gbé mọ́ but lóòótọ́ ó yẹ kí awareness wà generally not only during this period that was what we were doing that time. Every week we were, and I used to be very happy. Once I'm in the market, someone would say, Doctor Mori, television. I used to be very happy, but along the line, when the manpower reduced drastically, that could not take place again. But I'm sure there are other ways that can be done. Like you said, jingles and all that don't require our presence there regularly.
Of course.
Yeah, so I'm sure there are other ways.
And we hope you'd employ the services of Glow 99.1 of them. Okay, so very quickly, kó tó di pé a ṣojú òpó sílẹ̀ tó dájú pé àwọn kan ti ń wá láti pè wá wọlé ní láti béèrè àwọn ìbéèrè lọ́wọ́ yín. Are there modern technologies now available for early detection of glaucoma? Because the world keeps progressing, technology keeps advancing. Are there modern technologies, for early detection of glaucoma?
Yes, there are modern technologies.
Okay.
That even before there's any sign at all, before there's any sign, it picks it up. There are modern, and we have it available in our center.
That's great. From what age can you check your baby? A newborn? Can you check? Or from what age exactly?
What we have in our center takes care of from 18 years.
18?
Yes, from 18 years, but we'll get there.
Thank you very much. How does glaucoma affect productivity and quality of life if not treated?
Glaucoma, like I've said, is a blinding eye disease. And once it is not detected early and it is not managed and it progresses to blindness, the productivity of that person has dropped. And unfortunately, they will always need a carer that also needs to fend for himself or herself. So it affects even in the hospital. When they come, they have to somebody has to bring them. A lot of them, when they miss their appointments, mama kilo shele woni mo mi ò réyàn mú mi wá. So it affects not only the productivity of the person, it affects the whole family. That is why we are saying that people should have their eyes checked. Ká check ojú wa torí tó bá ti affect ẹnìkan àní tí ò bá ti ríran á affect ẹnìyẹn kò ní lè ṣeṣẹ́ òòjọ́ ẹ̀ á dẹ̀ tún affect àwọn tó wà láàrin lẹ́ni tí wọ́n jọ ń àwọn alábàágbé àwọn ará ilé because tó bá tún fẹ́ mú wá hospital á ní ìdèyàn láti mú wá torí tó bá mú dé á ní ìdèyàn láti lọ bá ṣe gbogbo nǹkan tó fẹ́ ṣe. So it affects everything and reduces the rate of productivity remarkably.
Ẹ ṣeun gan ni àǹfààní ti ṣí sílẹ̀ fẹ̀yìn ara lè láti pè wá numbers tẹ̀lé lè pè wá wọlé náà ní 0805 551 1110 má pè lẹ́ẹ̀kan sí 0805 551 1110 tàbí 0706 677 1822 má pè 0706 6771822. Ẹ jẹ́ kí n béèrè ìbéèrè ẹnìkan ti pè wọlé ìbéèrè dẹ̀ pọ̀ àmọ́ àkókò yìí ò tún ní tó wa pàtàkì wọn fẹ́ bẹ̀rẹ̀ mọ́ rántí pé ẹ sọ pé ṣé ṣáà lè lo àkókò yìí gan torí ìbéèrè pọ̀ bíi omi gan nílẹ̀ lẹ́. Hello ẹ káàárọ̀. Hello ẹ káàárọ̀. Good morning to you. What's your name? Your name is Akpan from Ijebiki. Could you please speak up? We can barely hear you. Can you be more audible?
Please tell the Akpan from Ijebiki.
Okay.
Can you hear me?
Go ahead.
Please, what causes brief blindness, like 30 seconds blindness, then the sight comes back? That one happened about 2 years ago. Then the tears that flows out from the eyes is peppery, and it can continue like 5 minutes. This one may happen like once a week or once a month, especially when I'm concentrating on reading. Please, is there a sign of glaucoma? Thank you very much, doctor. Good morning.
Good morning, sir. Thank you for your question. The first one you asked, please,
30 seconds.
you have to see your cardiologist, doctors that see the heart. It has to do with your cardiovascular system. So please kindly get to the hospital and see them. And the other one you also said you need to see us so that we can examine and know what is happening. But tearing for an adult is not it's not glaucoma.
Okay. Hello.
Ẹ
káàárọ̀. Kí lorúkọ yín bilẹ̀ tí ń pè wá?
Kọ́láwọlé.
À ń gbọ́ yín.
Ó ní ipa tí ojú tẹ̀ ń sọ yẹn. So mo ní ìpèníjà ojú ó ti tó bí ọdún márùn-ún báyìí. Wọ́n ti tẹ́lẹ̀ ẹ fi ṣe rare naturally but àbí just like artificial so attack me. So ìgbà tí wọ́n ń dùn ìṣá mo lọ sọ́sítì. Wọ́n ní mo ní eye cancer. Ṣé ìdí wà lójú nígbà yẹn? Mo ṣe ká sí ìjẹ̀bi ọ̀sítì so wọn ò rí ṣe. Ìjà lọ sí ìbílẹ̀ wọ́n á ń fún mi láti oríṣiríṣi. Gbogbo ìdílé lọ́dún ìbílẹ̀ náà wọ́n á lọ sọ́sítì. So later ìgbà tí wọn padà sí ìlú tí ìgbìyànjú náà ìṣègùn àwọn yà wọn lẹ́nu pé àbáwo lè gbìyànjú náà mo ní ọlọ́run láti mo ní àjọpọ̀ kan fún mi ni. So àwọn sáyẹ̀nsì ẹni sọ pé bẹ́ẹ̀ rẹ́bù ìmọ̀ rí nígbà tó ga ojú máa dry àjà ìpàrọ̀ ọgbó àìsí ní ìdílé kan fún mi máa ń kàn sí.
Ẹ ṣeun gan ni.
So nígbà míì ọgbẹ́ a máa fọ́ mi gà àtẹ̀rẹ́ rẹ̀ ó máa ń ní lára gún.
Kí ni ìbéèrè yín gan?
Omi ojú yẹn sì padà sípò. Kí ni mo wá lè fi omi ojú yẹn padà sípò? Nígbà míì bá yọ gíláàsì kúrò lójú. Mo rí ìran ọgbọ̀n tí a máa ní mi lára. Orí ìlú àfọ̀gà tó kù fẹ́ máa wà mí.
Ẹ ṣeun gan ni.
So orí ìkíni kan fa omi ojú yẹn.
Ẹ ṣeun gbogbo nǹkan tẹ́ sọ yẹn máa ní ìdá tí wàá rí wa ká mọ nǹkan gangan tó ń ṣe yín torí nǹkan tẹ́ sọ pọ̀.
Ẹ jẹ́ ká ṣe olúfìmọ́ lórí yẹn bẹ́ẹ̀ yẹn. Can spiritual causes, I mean, he mentioned one. Those using private number to call us, I'm sorry, we might not be able to take this call. You have to use your number to call us before we can take that call. So can spiritual causes be responsible for glaucoma? Because he mentioned a bit of it here. And he said when he got back to it, he had to tell them, it was an eye drop you gave me that one. So is there any correlation between them?
Unfortunately, a lot of our patients feel it's spiritual. But I can tell you, if we pick it early and we start treatment, the rates of progression will be slowed down and they might not go blind. But unfortunately, in our environment, they come in very late. Unfortunately, in our environment, they come in at 10 stage. They would have gone, like he said, they would have gone to so many, they would have gone to prayer houses, they have gone to every place, traditional and everything. And by the time that we're seeing them, it's advanced.
Let's take this call. Hello, Ekaro.
Ekaro, good morning, and thank you to our doctor in the house. I'm Ayodeji from Elisha Garage. Please, I want to ask, are there centers where laser treatments can be done in Akure?
Yes, FUTA TH. Our teaching hospital, FUTA teaching hospital, our eye center, laser can be done there.
Okay, thank you very much. Time is almost fast spent. Is it true that once you start glaucoma drugs, you cannot stop?
That was what I said, that the medication treatment, the treatment is for life.
Okay.
Just like you are treating diabetes or hypertension.
I'm going to be giving you those questions for a few seconds. I'll just throw them out because our time is fast spent. Can fasting affect eye pressure?
I don't know of any studies that have documented that.
Okay. Can diabetes, of course, you did mention that earlier, glaucoma cannot be prevented because we have quite a number of questions here. Is eye test painful? Many people are afraid.
It's not painful because we always use topical anesthetic agent. That means there's this eye drop. Before we do any, like to measure the eye pressure, we put the eye drop so you won't feel any pain. So it's not painful.
Okay, very quickly, are there free eye screening program? Free. In fact, emphasis on the free eye screening programs in Ondo State.
Yes, we just concluded one.
So it has to be, they have to wait till the next year.
You don't need to wait for a free eye screening to check your eyes.
Are they expensive?
It's not expensive. It's not expensive.
Okay.
You don't have to. We are talking of the eyes. We are talking of sight. You don't need to. It's not expensive. Just come in and check your eyes. Tell us you want to do glaucoma screening, and we do it fast for you.
Okay, what should people above 40 be doing regularly for their eyes?
Now, we have a lot of issues concerning the screen. A lot of people, because of the screen, always staring at the screen, always staring at the phones. And a lot of people are now giving their children, parents, please stop giving your children phones to be watching games and to be watching all sorts on the phones or tablets.
How about television?
And television. It's affecting the eyes. You know, television, you don't move close. You
There's
move
some
far.
children who love to go closer.
Once the child is going close to the television, the child is not seeing. Please bring that child to see us. A child that wants to enter the television, I tell parents.
Don't you think it's a normal children?
It is not normal children. The patient, that child is not seeing. Parents, any child that is going close to the television, the child cannot see. Please bring the child to us. You won't know, the child won't tell you. They are not seeing from where they are sitting, so they need to move in. So when we move close, so when we do the test, we find out they are not seeing. So please, any child going close to the television, thank you for reminding me. I wanted to mention it. Please bring them to us. They are not seeing.
But you know this is common among children. Most children.
Most children are not seeing. Most children are not seeing.
Really?
We see a lot of children now that need glasses. Most children are not seeing because those days we used to play outside. But now, we parents, we lock them up inside. So they stay indoors. They can't, their eyes are not, and they're growing. Their eyes are not developed to see something that is far. It's developed to see things that are around them.
So it means they should allow their children to play
In Asia, they have now making it compulsory that children must play at least 2 hours outside because they're finding out that it's affecting children. So please, parents, any child that is close to the television, bring the child to see us. The child is not seeing.
Of course, the program is getting more interesting, but we just have to go now. Oh, very quickly. You're
Very quickly.
Yes.
A lot of people put so many objects, so many things in their eyes. Kafura, camphor water, breast milk, urine, all sorts. Please and please, especially when there's an outbreak of viral conjunctivitis known as Apollo. Please don't put anything in the eyes. Please, there was a family that they had told them to put battery water. The father put battery water, the mother put battery water, and the 4 children, and they were brought to our clinic all blind during outbreak of Apollo, viral conjunctivitis. Somebody advised them, buy omi battery sí, wọ́n dẹ̀ fi omi battery sí ojú yẹn dẹ̀ fọ́. Ẹ jọ̀ọ́, ẹ má fi gbogbo àwọn nǹkan báwọn yẹn sí ojú. Breast milk, omi ọyàn, ẹ má fi sójú àwọn ọmọ wa o, ẹ jọ̀ọ́. O ìtọ̀, ẹ má fi sí ojú.
All right, thank you very much, those who were trying to read. Not to worry, we might have a repeat of this, but we just have to give up. We've overshoot our time, but we have to beg for apologies from the head of program. That's how much we can take on today's edition of Glow Earth Talk. Thank you very much, Dr. Miss Adegbehingbe, for coming on the program this morning.
Thank you very much.
All right, until next week.
Omolafe.
Yes, until next week when the program returns, we'd like to say a very big thank you to our executive producer, Dr. Ezekiel Akonde, and of course to the producer of the program, Dr. Komolafe. Many thanks once again to our guests for reaching out to us. We called you and you yielded our call. Thank you very much for coming on our program.
You're welcome. Thank you very much.